Hello, this is Jeana at Artist Skincare, and today I'm going to demonstrate for you a power facial that you can do at home. I was so lucky today to get my mom Maxine in here to be our model, so I'm going to be showing you how I do this facial, but it absolutely is a facial that you can do on yourself. Now I'm going to be answering questions throughout this video, but I'm going to be answering them in the comments. So if you have questions, don't worry, type out the question. I will respond to you in the comments, and I'll make sure that all the questions are answered by the end of our show. This is a show that's going to be filmed in 3 stages. We're going to do this facial 3 times over the period of 1 week to show you the kind of results that you can get at home doing this treatment. We're going to be using the Artist Skincare Nano Pen. A Nano Pen is fabulous for stimulating collagen production. We call it collagen induction. So it's stimulating that collagen in the skin so the skin is renewing, it's plump and dense and healthy. So let's get started on this right away. I'm going to start off with Glymed Glycolic Cleanser. I'm using a cleanser that has a little bit of acid in it. I want it to have a little bit of acid because an acid will break those bonds between the skin cells so that we can slough off some of that old dead skin on the surface. So here we go. Now when you go and you get a facial in the treatment room, you get to have this wonderful facial massage. Well, guess what? Your hands are actually your best beauty device. So go ahead when you're doing this facial at home and do a nice long 2-minute massage. This really gets the blood circulating, it moves the lymph along, and it's just so healthy for your skin. When my kids were in high school, they used to come over to the spa on their way home every day, and they would grab one of these hot steam towels, especially in the winter time, because they felt so good. Now Maxine is my mother-in-law, and I met Maxine when I was in college. We were such babies back then. You were a baby and I was a baby, and I look back all these years. All right, so we did our first cleanse with a glycolic cleanser from Glymed. And now we're going to grab an enzyme cleanser. I like to follow an acid cleanser with an enzyme cleanser for a reason. And that is because the acids will break those bonds between the cells, and then an enzyme is going to come along and eat those cells, kind of digest them away like little Pac-Men. This is Dr. Estee Enzyme Deep Clear Powder Wash. And I love this. My husband loves this cleanser because he says, I don't have to pay for water. There's no water in this cleanser. It's purely the powder, which is an enzyme. And then we're going to activate those enzymes with water.
It's my favorite cleanser.
You love it too?
I do.
So I've got one hand wet, and I'm going to mix together and create a nice little foam in here. Nice and smooth. And then I'm going to, again, massage the skin really well. Loosen up any dead skin cells. And I'm doing all this at the start of my facial because we're going to be using some wonderful serums. We're going to be using the Nano Pen, and we want to be able to really penetrate and drive these serums as deeply into the skin as we can. And who needs that dry, rough skin on the surface, right? We need to get rid of that. Maxine, your skin's feeling so good.
Well, it's what you give me to do. I do everything.
Well, Maxine can have a tendency to get some dry skin on her chin and just under her chin, and it can sometimes feel really rough. But it doesn't today.
Well, that's because all the
good
good stuff.
Skincare. Maxine is just really concise.
And consistent.
Consistent. That was the right word. Consistent. She's very consistent with her skincare routine, and it really pays off. Now, Maxine, we're going to be doing a treatment that I haven't done on you in a few years.
Okay.
We're going to be doing a nano needle, which is very similar to the microneedling we've done in the past, but with this we have a silicone tipped needle instead of a metal needle. So it feels a little better on the skin, but you'll feel it.
Okay.
You're gonna feel it. I'm gonna use Isocell Recovery Solution. This is what's gonna give us our slip and keep the skin moist as we're doing the needling treatment. So go ahead and keep the eyes closed. I'm just gonna give you a good misting. There we go. I'm gonna turn on my Nano Pen. And I'm going to start with it on the lowest setting so that she can start getting used to how it feels. Let's start down here in this area. You tend to want to start on the forehead, but it's better to get a sense of what it's going to feel like and get those endorphins moving before you go up to the forehead, because the forehead is where it feels the most intense, because that's where that bone, the skin is thinner there and you're going against that bone. Let's get a little more. Skin is just drinking up that moisture. Got you good that time.
That's good.
There we go. If the needle doesn't just glide right over the skin, that means you need more moisture on the skin. Now we're gliding really nicely. Now I'm being careful not to use any pressure. I'm just gliding the device over the skin without pressing down. How does it feel, Max?
Nice. It feels comfortable.
Okay. All right. Let's go ahead and bump it up. I'm going to go to...
No discomfort.
Great. We're going to bump it up all the way to the third setting, which is the red setting. How's that feel?
Still feels good.
Great.
There's no discomfort.
No discomfort at all?
No.
Great.
Like a little tickle.
That's great. More moisture on here.
So is that full strength?
This is full strength now.
No, it doesn't. It's not discomfort at all.
Great.
On some people it is?
It can be. We'll see when we get to certain areas. Up here it might feel just a little bit aggravating and we can turn it down. But it is very gentle. It's much more gentle than using an actual needling device.
Not the same at all.
So I'm working in just little sections.
Will this help with those lines?
Yes. It's going to help with little lines. It's going to help to stimulate collagen repair in those areas.
I'll take it.
This one works. This one works better. This little size actually comes with the Nano Pen, and I often like to refill it and use it because it's just easier to spritz without getting the spritz in your eyes. Heading up towards the eye area. So when I'm working in an area where the skin is just a little bit looser, I don't want to drag the skin with the nano device, so I just lift the skin, give it a little tension, and then go ahead and needle over the area. Now I will turn it back up. Turn it up a little higher. With this little area, she's concerned about these little dark spots. She's got a little hypopigmentation going in this spot. So we're going to do a little extra with the full strength Nano Pen so that we really maybe lift some of this pigment, but also we're doing this to prepare for our plated serum. And we want that plated serum to really be able to penetrate in this area and really do some healing work for this little bit of sun damaged area. So I'm going to be sure and send Maxine home today with a powdered sunscreen. This she can keep in her handbag or even in her car or her husband's car so that she can reapply when she's that passenger or when she's driving. Just the minute you get in the car, Maxine, just reapply the powder all over, especially in the little areas where you know you're prone to that sun damage. And that'll give you that extra protection you need while you're driving. Now what we want to do is we want to drive in our stem cell cytokines or our exosomes, growth factors. This is what we want to feed the skin with. So what comes with your Nano Pen is the plated daily serum for a limited time. Plated has been so generous to help us put these into the kits with our Nano Pens. But what I'm going to do is what I do at home for Maxine. And this is that upgraded plated serum. This is Plated Intense. Plated recommends that you use this serum, the Plated Intense, for the first 6 weeks. And then you go to daily for your maintenance skincare. But some of us at Art of Skincare are kind of skincare junkies, in case you haven't noticed. So many of us are using Plated at night and then using the daily serum during the day. So you want to get Plated Intense on your skin once a day for the first 6 weeks. First 6 weeks. You don't want to needle this into the skin because that will damage the delivery system. We don't want to damage that exosome that's actually traveling into your skin and speaking to your cells. So we put it on after we needle. We've created all this nice little openings in the skin, and the skin is more permeable right now, and that's when we want to put on our exosome serum. Now I'm also going to put some of the Plated eye serum on Maxine. Doing her upper and lower lid. Maxine, your under eyes are looking so good.
Well, I've been using that. I'm down just about out. Is it the detox? I mean, what is it? Tox X?
Detox. Dr. S.A.C. Talks for the
Yes.
eyes. She loves that one.
That's what
Yes.
I put it on morning and night.
That's great. All right, now what we're going to do is we're going to mix up our CO2Lift Pro Mask. This, we've got a set of 3 here because we're going to do this mask 3 times in 1 week, and that is what is recommended. 3 times in your first week and then once a week for the next 4 weeks, and then you can taper off to once or twice a month. So we're going to get going here. It comes with 2 little packets. The first pack we're going to put in is this gold pack, and I have a nice little bowl for it here. So this is a carboxy acid treatment. So carboxy is amazing. It's like putting your face into an oxygen chamber. We're going to just smother your skin with this wonderful carboxy, and it's really going to increase the oxygen to your skin. Max, I'm going to go right over your mouth.
Mm-hmm.
I'm going to leave your nose uncovered so you can still breathe. I'm even going to go right over the eye area.
Okay.
So I went ahead and I applied 2 packets of the CO2Lift Max on Maxine because I just couldn't resist her neck and chest. So we have 1 packet covering her face, the other her neck and her chest, and a fairly thick layer. We want to leave this on the skin for 45 minutes to an hour until it's completely set on the skin. Now, when you do this on yourself at home, you don't go over your eyes. It'd be pretty hard to do, but you just go around the eyes and it works just great. Now, since Maxine's here and I'm doing the treatment for her, this is an opportunity for us to just put it completely over the eyes and let it do its work. So now we're just going to let Maxine have her little siesta, and we'll come back in 45 minutes.
That's true.
Oh my gosh, the skin looks so amazing.
Oh, amazing. Good.
Amazing. You're going to love it.
Great.
All right, so this is the end of round 1. We're going to come back and do this 2 more times before we're done. See you again. So you've had 2 treatments with the CO2Lift Mask.
Mm-hmm.
This is the carboxy gel. We put it on really thick over your face, and you have to lay there for 45 minutes with it on till it sets.
Mm-hmm.
Did you notice anything after we took it off?
Oh, I couldn't believe how my face just felt plump. And I wasn't the same face anymore.
It
That
was
was
a
after
change
the
in your
first
face.
one.
Just the first one, you noticed
Yes,
a
I
difference
just-
with that.
But I've still noticed. I mean, it's lasted.
Even after the second treatment, you were still seeing it. Now, you mentioned to me that you've noticed as you've gotten older that your eyelid is. Tell me
Yes.
about that.
Well,
What was
my
experiencing that?
eyelids have gotten, how would I describe it? It's red, like red lines, and they're thick lines, and so I use eyeshadow to cover it up. And I've noticed just this last week that one eye doesn't have it. So somehow
The treatments are helping.
but the other eye still does.
Yeah. Okay. So we'll work on that.
Okay.
So two things I think that are helping with that. One is that the CO2Lift Mask immediately removes redness. In fact, when we first take it off, we look really pale. And in California, we're used to seeing our skin looking more tan and more
Right.
rosy. We're like, wow, I'm really washed out now because it really just calms all inflammation. So I think that that was probably helped by this.
Look forward to that.
Yes, I have also started Maxine on a new nighttime eye serum, and it's the plated eye gel.
I use
And
it.
I suspect that that's doing the trick as
okay,
well.
okay.
So it'll be interesting to keep watching that and see if the other eye catches up.
Yeah, I'll
That'd be
definitely
great.
look.
Because it is true at any age, but especially as we get older, we do see the skin thinning and getting more delicate around the eyes, and it needs more healing support. So the plated serum with the exosomes in there really goes to work at rebuilding the integrity and the strength of the skin. So Maxine has been, like me, she uses the same skincare I've used for quite a number of years, the Cavapla
Yep.
and all of that, and you love that, but I thought summer's coming and we all like a change, so I started you on a new skincare routine.
And I love it.
You love it.
I
Oh,
do.
good,
I
good.
do.
So let's go ahead and go product by product through your morning and then your evening routine. And I just want to ask for your feedback on them, what you think of them. So I've started you on the glycolic facial cleanser.
That's my favorite cleanser I've ever had. I love it.
Really? What do you like about it?
It's soft. It's just feels just yummy.
So it feels real cushiony.
Yes, and it's just you just want to keep rubbing it on your face.
Now it says here 10% glycolic acid. And so normally even for me, that would freak me out. I'd be like, oh no, I don't want that much glycolic acid on my skin. But there's something about Glymed. They've really perfected their formulations with glycolic acid. So did you have any burning or stinging or itching or irritation? No.
Nothing. It's fluffy. It's wonderful.
Wonderful.
Like a pillow.
That's great. And you're using it every day?
Every day in the morning.
Every day. And
In the
it's
shower.
not over drying you out or anything. Your skin
No,
looks great.
Not at all.
It's wonderful. Okay.
It's very nice. That's
Now,
very good stuff.
really good. Now, the toner that we're using for you is new for you. It's
I
the
like it.
Anti-Mela Toning Toner from Dr. Estee. And first of all, let me spray some on your hands. And the scent. How did you feel about the scent?
It's not that strong.
It's very light,
Yeah.
isn't it? It's like a light,
I'm trying to give you
kind of a
name.
citrusy.
I was going to say watermelony, but it's very
Yes,
faint.
yes, I would say that too. Light watermelony.
Very
I'd like
faint.
to get people's feedback on scent because everybody is so different, and some
It's
people
just-
want no scent, but this has a scent, but it's very light and natural,
And delicate.
and it's a natural fragrance. It's not a synthetic fragrance put in there. But this, I gave Maxine all three of our new anti-Mela toning products, the toner, the serum, and the cream, because you'll remember at the beginning of her facial, she talked about some hyperpigmentation spots that she was worried about and wanting to know if we can lighten them up some more. So these are really to target
I
that
think we
area.
have. Look at
You
that.
feel like it's lighter already?
I do.
Great,
I mean, I'd like it lighter, but
Of
I mean,
course, yeah.
It's great. It's much better.
Okay. So, and the serum
Yes.
and the cream,
Yes.
liked those,
I-
no issues with using them.
No. The only thing is I'm not used to it so thick, and so
Yes.
I'm getting used to using a thicker cream.
Using a thicker cream and maybe use a little bit less cream so that it doesn't feel so thick. You know, if you
Well,
have
it doesn't
too much.
feel thick on my face.
Oh, it's when you're putting it
It's
on.
when you're putting
feels
it on.
different.
No, it's
Okay.
sometimes I do like 1.5 for my face.
Okay. So anti-melatoning cream, I think it's really a balm. So what you're describing, it's not really a cream, it's like a balm, right? It has that
Yes.
kind of thicker feeling
yes.
to it. And it also has these kind of luminous brighteners in them. And I love the brighteners. That's why I like to use it on my neck, because those brighteners just make the skin on the neck look so smooth and beautiful. And so a lot of times when you have a thicker cream like this, put it in your hands, but then warm it a little bit and then pat it onto your skin. And then that might work better for you.
I think it will.
Yeah.
Thanks.
You're welcome. Okay, during the daytime, we also have a barrier support product for you going into summer, because Maxine is an avid gardener. She's out in the yard. How often?
24/7.
24/7.
I'd be there at night if there was sun.
Yeah, and you have a little dog too, and so you're out walking the dog as
Right.
well. So I wanted her to have good barrier support. So I put her on Color Science Barrier Pro as her moisturizer during the day. This is going to give her good barrier support and antioxidant support. And I also love the Total Eye Cream. This is for her daytime eye cream. Really yummy. This will also calm redness, but you're not probably using this right down on top of the eyelids. So I'm thinking it's this stuff that's doing such great things there. But what was your assessment on these? How are they using them?
This one.
You don't have this one.
No.
Okay.
But that's okay.
We'll figure out which ones you're
But I
using.
do have this.
Okay, you
Yes.
have the moisturizer.
Yes,
How's
and-
that going?
I like it.
You like it?
I only do it once though.
Yeah,
Okay,
just in the morning time.
that's correct. Okay,
Yeah.
I thought maybe I was doing it wrong.
Nope.
Perfect. Perfect.
Great.
Perfect.
Great. Okay, now a couple extra things that she is starting new. We started her on a new sunscreen.
I like
So we
it.
started her on the Color Science Classic, and we had her on Flex Medium, but Flex is that wonderful one that looks white when it goes on, then it turns to a color, and it really can be a foundation, actually. It's a tinted sunscreen. So, but that was too light, and then the next step would be too dark for her. So we decided to try Classic. We went between Classic and No Show, and let's have your hand up here.
And I like it.
Max decided that she really liked the color from Classic. So No Show is just clear. It's white, but it goes clear. This one, as you rub it in, the Classic, it has a little pinkness to it, but it completely rubs in and leaves a little luminous glow to it. So that's the winner.
It's very nice.
Loves it.
I do.
Yay. Then I gave her a 2-step finishing. This is new for you. So you're putting on your powder.
Yes.
And this was specifically recommended for Maxine because of the spots she's getting when driving in the car. I even said you can put this on your face and on the back of your hands before you drive. Have you played with it yet?
Yes, I have.
How was it?
Good.
Liked it?
Yes.
Just went on. She has the glow color, so it doesn't really give a color or anything, but it just gives the skin a nice glow.
It does.
Great.
And it's
And then I had her finish with a little spritz. When you spritz over these powders, it actually turns them virtually waterproof. So very water resistant. So it's a great way to boost your sunscreen during the day. Now, nighttime, we kept it pretty easy.
Very easy.
This has been your easiest routine. We've had more complicated routines.
I keep thinking there's something missing.
There must be something missing. Like, I'm so glad.
It's very, very quick.
Okay, so in the evening, we're using the glycolic cleanser, or are you using which cleanser?
No, I'm using a different cleanser. It's in a tall bottle, and it's kind of dark. The bottle looks black.
All right, so we figured it out. In the evening, I gave her the Color Science Barrier Pro Cleanser, and I gave her this. I chose it because it's a wonderful, gentle gel cleanser, but it removes all traces of makeup, and it's so gentle that you can use it around your eyes with no irritation or problem. Now, Maxine has in her younger years had oilier skin, but it's getting drier, huh?
Yes.
So I figured that this is going to be a good cleanser for her. How did that feel?
Oh, I love it. It's
it
good.
got it clean. Good, good.
It definitely gets all the makeup off.
Great. The way to use this cleanser is to put it on dry hands, kind of rub the hands together, and then rub it on dry face and kind of loosen up that makeup or sunscreen, and then get your hands wet and then emulsify and massage again. And that's why you break up that sunscreen and makeup and then add the water, and it all just comes off really beautifully.
Good.
Really nice. Yay. Okay, and then we have you've got your melatonin toner if you want to use it in the evening. But the new thing I started you on was plated.
Yes.
Now, I love plated for Maxine because she's had a couple little spots of cancer here and there taken off. So I want to be careful about what kind of growth factors I put on her skin. And I 100% trust plated for her. It's oncology safe. And the neat thing about the exosomes in plated is that they go to work and they send messages to your cells to turn on and do stuff. And where growth factors tell those cells to turn on, they don't tell them to turn off.
Oh.
So when plated goes on your skin, it's going to send a signal, but then it also sends that signal to turn off when it's done. So that way we don't have to worry about indiscriminate cell growth of cells that we don't want to grow. So it goes in, does its work, turns off, and then it's done. So we've got her on the plated intense. Many people like to use this as their nighttime, and then they use the daily serum from plated as their daytime. But I just wanted to start Maxine off with plated because I wanted to see how that goes for her skin. I find plated to be very firming, and I was really excited to get you started on this one. The instructions for this bottle say to use it for 6 weeks and then switch over to daily serum. But some of us get so addicted to this one that at 6 weeks we keep using this one and then we add daily serum just during the day. But that's because we are skincare freaks. And then the plated is what she's using around her eyes.
Yes.
And we cannot keep this on the shelf. It keeps selling out so fast that I have not been able to take one home. And so I've been jealous. You've got it at your house, and I don't have it at my house.
I don't have it
You
yet.
don't have this one?
No, you didn't have it.
Oh,
You were out of it.
That's funny. So I wrote it down on your skincare protocol, but you actually didn't have this yet. So this hasn't contributed to that lightening of the redness
wait a
of your
minute.
eyes.
No, I have that one that has the little thing.
Yes,
I thought
you
were
do
talking
have
about-
this.
I'm sorry. I do have that one. And I love it.
Okay, so you are using this one, and this has this wonderful, this is a special metal
I love it.
on this that stays cool.
It's very nice.
So it's so refreshing.
Comfortable.
And this gel, especially because I have you using it at night, you can go right over the top of your eyelid, right down next to the lash line with no problems or irritation.
very nice.
It's really wonderful. But yes, you have one and I don't.
I'm sorry.
But I'm going to get one soon.
I do have that. I didn't recognize the bottle.
I know. But that's your simple.
It is
nighttime.
simple. It's simple and quick.
Yes.
That's what I like, is how quick.
Yeah, that's great because at nighttime we're tired.
Yes.
We don't want to spend,
No.
you don't want to put three different steps on or rotate nights. Sometimes it's good to keep it really nice and simple.
I would say
On top of
7
that,
months.
she's just putting on her melatonin cream. Pat, pat, pat all over.
And I had to get used to that because I use night cream.
Oh,
which
okay.
I love.
I know you do.
But
she is a night cream. The Emma Pell night cream is her favorite
Yes.
night cream, and she's been on it for a long time, but I'm making her cycle off of retinol for a few months for this summer. I like my clients, some clients especially, some more than others, to take a little break from their retinol in the summer months because retinol can make the skin more sun sensitive. And Maxine is in the sun, like she said, 24/7, and her cheeks can start to look a little too rosy. So I've kind of backed her off her favorite cream, but I'll put you back on it in a few months. But we've got her on the plated and the new Toning. So is this feeling like enough cream though? Enough moisture?
I think so.
Okay.
At first I didn't think so, but
Okay.
I think it feels
You're
good.
getting used to it.
I'm getting used to it.
Okay.
It's a new feel.
Okay. As you get used to that new feel, if you find that you just feel like you're still needing a bit more moisture, just let me know. And we'll
Okay.
just adjust it, or add a little drop of essence or something that we can put over the top to give you a little more
Okay.
moist feel.
I probably wouldn't like it, but I mean, if this is okay, then what would it be?
Okay. Maxine, her favorite brand as far as sensual experience is Rhonda Allison.
Oh, yes.
So the way I could really take this over the top for her is by giving her Rhonda Allison's Drop of Essence Hydration Drops.
Oh.
And that just has that luxury feel. It has that amazing scent. And she'll put that on and be ready for bed. She'll just go, oh, that's got that
I would love it.
amazing.
I would love that.
So we'll send you home with that. That'll be that little perfect topper that you can
Yes.
use whenever you need extra moisture.
Oh, I like that.
So we're going to get started now. I'm going to get started and do Maxine's third treatment, and then we'll have her we'll take it off and we'll set her down to do the before and after picture so we can kind of see the little progress going with doing her power facial treatment. Now we've done the CO2 Lift Mask. This will be her third time. And that's what's prescribed, to do it 3 times in the first week. And then we need her to do it once a week for the next 4 weeks. So I'll be sending her home with it. So she'll get to play with it at home, load her face up, and then go sit back. Once a week, that'll be your meditation and your little self-ritual, self-care time.
It'll be good.
Okay, great.